Delhi AQI level tells the story of pollution in Delhi. Recently, All India Institute of Medical Sciences, Dr. Anant Mohan and Saurabh Mittal conducted a conference, and they had given some guidelines for the people where how could they survive this pollution. Please look into that.
Pollution is again going much beyond safety limits into severe zones more often than not. So basically, it is important for everybody to know. Of course, now everybody does know what are the health effects or the health bad effects of poor air quality. Everybody knows now, but it's a process, and one needs to be aware about it again and again. It needs to be reinforced for people, especially for the kids and for everybody. They should know the harm that this brings, because only when we start working at the grassroots level also this problem can be taken care of. As far as the problems health effects are concerned, again now it can affect every part of the body. It goes without doubt that environmental pollution will affect every organ of the body. It can affect any age, right? In fact, even before birth it can start harming the child even before birth, right up to the end of life. And again, there is, I think, substantial evidence, not direct, but there is evidence that it definitely reduces the lifespan, poor air quality, because of various diseases. So you all know that obviously these are situations where you will not immediately connect that this disease is because of air pollution. You cannot connect. These happen over a period of time. So, but it is definitely now known that this will happen. So, respiratory diseases are the mainstay. They are in direct. We are in direct contact with the atmosphere. We are breathing day in and day out. Our lungs are getting affected definitely significantly. Number of patients are actually increasing. So, people who were previously healthy are now becoming diseased. People who are already diseased are becoming more diseased. Death rates probably are increasing because of this. So, and then there are other factors: cardiovascular factors, neurological factors, mental factors, psychological factors, problems in pregnancy, problems in children, problems in lung growth, and other things. So every organ is affected. Just to tell you the magnitude of the problem, I'm just trying to tell you that. So I think because of this, as of now, we have reached emergency situations in Delhi. That is all I can say. And efforts have to be short term as well as long term. It cannot be only temporary short term effects that may help immediately for a little while, but it is not going to help much. Long term solutions to this city is urgently required. So that is my own thinking as a citizen also of this place where I've been staying.
So I think the problem is that we think about it when winters come. So we talk about pollution when November, December comes, and those 3 months we are very active. We are thinking there's so much in media, but even in the summers, the air quality is not good. So air quality remains suboptimal as compared to the global standards, even when the weather is fine. So we need to work on solutions which work throughout the year, not on a short period of time. So and that the annually or the throughout the years, whatever exposure is happening to people for years, what will happen to them? That's what sir was telling, that over the years we'll have so many problems which will happen because of the cumulative exposure to this air pollution.